in Brazil, you have 210 million people. You have a right to care, but in fact, the government is underfunded, corrupt, unfortunately, in many instances, and the money doesn't go where it's needed, meaning that despite having this free healthcare system, it can take up to a year to access a doctor, even a GP or a pediatrician.
Hi, welcome to the Qonversation. I'm Eleanor Sackernode, and today we're speaking to Kat Wendelstadt. Hi, Kat.
Hi, Eleanor.
So Kat's a marketeer who specialises in go-to-market strategies and on helping startups reach their next growth phase. I hope I'm getting the language correct. Having been an executive and co-founder of startups valued at $1 billion. So you're ex-Nokia, ex-Microsoft, and now besides working in advising startups, a lot of which are in health tech, you're also an angel investor in some 20 or so startups. So thank you for being here. Let's get right into it. Where did your love affair with health tech begin?
So it started in Singularity University, which is an entrepreneurship program in Silicon Valley, where I spent 3 months trying to come up with a business idea that could have a positive impact across 1 billion people within 10 years. And that so happened to be in healthcare. And we formed a fabulous team, raised initial funding, and the company is now 10 years old and raising a Series B currently, working on cancer vaccines. And that's where it all started. And after the project, I was living in Brazil at the time, and after the 3 months spent on site in Silicon Valley, I sort of had a serendipitous meeting with a health tech founder called Thomas Ruji, who was building clinics for the middle and low income population in Brazil, in Sao Paulo, and he had built 4 clinics. He was really inspirational. I was 9 months pregnant, and we hit it off, and he offered me a job on the spot, which I took. So that's how my foray as into healthcare really started.
So that's interesting. So you said yes on the spot to a job offer at a dinner party, essentially. Was it the man? Was it the product? What was it about this particular job that set the course of your career, really, in a way, or reset?
Basically, first of all, it was the man. He was very interesting. He's a mathematician, highly articulate. He'd been a successful founder in a different field previously. He had access to talent, he had access to capital, and he'd already shown that he could execute because he'd built 4 clinics. Secondly, there was a really massive problem that he was solving in a novel way, and to me, that was a pretty irresistible combination to work with an inspirational, visionary founder solving a big problem for a population that needed it. And I knew at that time, about 10 years ago, the ecosystem in Brazil was nascent. There really wasn't much foreign capital flowing in. There weren't that many sophisticated founders. So I was very lucky to have met him when I did.
So let's talk about that. You mentioned that there was a clear need. So what is this need that this company fulfilled, and talk us through the journey of the company?
Sure. So the company is called Dr. Consulta. It's a chain of primary care clinics. So essentially a walk-in clinic full of GPs, gynecologists, orthopedic specialists, physiotherapists, etc. So anything you need for your day-to-day health, including exams and imaging. And in Brazil, you have 210 million people. You have a right to care, but in fact, the government is underfunded, corrupt, unfortunately, in many instances, and the money doesn't go where it's needed, meaning that despite having this free healthcare system, it can take up to a year to access a doctor, even a GP or a pediatrician. So what happens is that 75% of the people aren't insured, and they just have to wait. And you can literally die in the waiting line to see a to see a doctor. So Dr. Consulta, the company, was providing clinics in locations where there was a high concentration of middle to lower middle income patients, and they made the consultations affordable. So they took more junior doctors, but from good hospitals with good education, and essentially built more of a volume system. But that is so much better than waiting in line for a year. So that's essentially the need they fulfill, just access to good doctors at a reasonable price.
So is that the health tech startup that became the largest in Latin America?
Yes. So the company started out with, when I joined, it had 4 clinics. During my tenure, I was the first chief marketing officer there. We built it from 4 to 30 in 18 months, which was quite brutal, as you can imagine, in terms of pace. And at its height, it reached about 60 or odd clinics, and today it's serving about 2 million people. It's in several different states in Brazil, and has become the largest primary care provider across the continent.
Thank you. From there, you went on to work for other health tech startups. Is that right? Also in Brazil and in Asia?
Yeah. So essentially, we at Dr. Consulta, we built a sort of a blueprint for how to build and scale low-cost primary care. So that model I replicated as a co-founder with a different twist, not selling to end consumers, but selling to insurance providers, in a company called Amparo, that stands at 11 clinics today and was acquired by a diagnostics business in the country. And because this sort of low-cost primary care model is relatively new, it's about 10, 12 years old, Dr. Consulta was really the pioneer in this and was recognized so globally. So after we'd done the work and had the results to show for it, other things came my way. One of them being a healthcare clinic and healthcare chain in Bangladesh. So I started as an advisor and then ended up as the chief growth officer of the fastest growing clinic chain in the country, essentially providing the same model, same problem there, 170 million people, but in a much geographical area, 20 million people in Dhaka, in the capital, also with no access to decent care.
Extraordinary. So there's clearly a theme. So there seems to be a running a theme that obviously healthcare, whether east or west, or certainly in Europe, we're feeling the pinch, is quite hard to access these days. That seems to be one of the main trends in a basic supply and demand kind of way. What would you say are the big trends in health tech specifically?
I mean, obviously, all the rage at the moment is AI and how it's going to transform the sector. And we've seen sort of early applications of it, medical imaging. So you can have AI looking at radiology exams, still today in conjunction with a specialist, but that obviously is allowing high accuracy, less false positives, false negatives. You have obviously diagnostics and disease detection, personalized medicine. We're not really there yet, but it's in the future you're going to have a cancer treatment that's entirely tailored to you and your body, you and your body makeup. Bringing drugs to market faster, so having large throughput of analyzing what particular proteins react in the right way with medication, predictive analytics, understanding how using technology and AI to bring drugs to market faster by improving the regulatory process that today is largely manual and really bureaucratic and arduous. So there's a lot of things happening faster and more rapid. Tests. I've just come off the phone with a company that can detect the most deadly stroke within 15 minutes from a blood finger prick, and what it will do is it'll get you to triage you to the right care, which is the difference between a life of disability or death. versus a much better outcome. So there's a lot of really, really interesting things happening.
Thank you. So you've worked obviously in helping startups also reach their next phase of growth. Why primary healthcare? Is that a high growth domain in tech in particular? Is that where the biggest leap can come from? What makes you choose that specific sector, or is it just because that's where your experience has come from and so you can add value as well?
I've not only played in that area, but I keep coming back to it, because I've got the experience and developed a lot of the playbooks and how to scale within primary care. But it's also the area that, if you get that right, is where you deliver most of the cost savings further down the line. So a broken primary care system means people go to A&E for a cough and they clog up the space for other people who need it more. A broken primary care system means doctors are exhausted and they're leaving the profession. A broken primary care system is a system that can't take care of its population that is getting increasingly older, full of lifestyle diseases ranging from obesity to diabetics to socioeconomic health issues, smoking, drinking, etc. And so there is a lot to be done, and if you get that right, you essentially, it's the bottom of the healthcare pyramid. You prevent the problems further up the food chain. And given the fact that we have, for example, in the UK where I live, we have a lack of 6,000 GPs. So you can imagine what that does. Plus, the entire NHS workforce was on strike earlier in the year. So the backlog from COVID was there, still being worked through. Then you had doctors and nurses on strike because they're not getting paid in the same way. They don't have the right conditions to do their job. And it just becomes a sort of self-fulfilling prophecy at the same time, under pressure from more demand and sicker people.
Gosh, the future is bright. So
well, the good thing is there's a lot of opportunity to do things better.
Well, we've got well, this is something that came up yesterday. I attended the Web Summit in Lisbon, which I understand is going to be in Doha in February 2024. And there were quite a number of breakout sessions on health tech and med tech. And there was one chap who's, I think, the founder of Happy AI, talking about how people are already being helped virtually, that it cannot yet replace, of course, a person, but they believe that even being able to voice your issues online on an app that might be a bot is already deemed helpful. So there's a lot of work there seems to be also going in tech, in mental health as well, which I imagine is another area that's probably expanding rapidly. What would you say are the main segments within the healthcare industry that have the highest opportunity for growth, I guess, but that may equal a deficiency that we have? Or is it too many? Is it across the board?
There's a lot. There's obviously what comes to mind immediately is femtech. Women have consistently been underfunded. Women's health has been underfunded. Clinical studies have been done on men. Women's bodies function completely different. A heart attack manifests differently in a woman to a man. So women overall have worse health outcomes when it compares to men. Drugs have been tested more on men than on women. So plus there's a whole array of understanding and needing to understand women's bodies, from hormones to menstruation through to menopause. So that's a really, really large area that's unfortunately seen less funding since the COVID pandemic. But when you compare it to sort of 5-8 years ago, that wasn't a thing, and now it is a thing. So there's a huge opportunity for growth there. Mental health, of course, including psychedelics and sort of pushing that boundary. Everything from sort of digital assistance and bots, like you say, to employee wellness, through to constant monitoring of mental health conditions through biomarkers like your voice, facial movements, tone of voice, pitch, content. And so a lot of money is flowing now. Adoption isn't really wide yet, apart from because there's a lot of ethical considerations. Because if you an AI can't triage a patient yet for mental health issues, because what happens if that person ends up doing something to themselves? And then obviously a lot of money flowing into drug discovery, and essentially bringing more drugs to market faster, because it takes about $1 billion and 10 years to bring a drug to market. So you can imagine how how big the need is, especially from cancer through to more orphan diseases that don't get the funding that's needed.
Thank you. What are the things, because you're an angel investor now in some 20 companies, what makes you invest?
I think it always starts with a founder. They have to be exciting. And how are they exciting? They're exciting if they have a particular insight to a problem that is novel or different. If they're great storytellers, obviously you look at what they've done already with sometimes very, very little, and the team they've been able to build around them. The second thing is there a big market, and you have to understand whether, and sometimes it's a bet, of course, whether what the specific power of that person and that team is in order to make the investment be 10x, 20x, 30x, because it's got to have the potential to be absolutely massive, because the failure rate's also quite high. And so and then you just look at how are they going to go through the steps in order to remove risks, and how they think about that.
Thank you. You mentioned in our prior conversation that you also are looking for impact investment, which is another term that I heard a lot yesterday at the website. So let's talk about impact investment and why that's important to you.
In fact, I only invest in companies that can make the world a better place. Obviously, that's a wide term, but I have invested in founders of color. I've invested in quite a lot of women startups, a large majority in health, where by definition you're going to make, by solving a problem, be it from a brain aneurysm through to a better incubator for newborns, it's going to improve the status quo for whoever is the recipient. So I'm not really interested in pure e-commerce or ad tech. I'm interested in seeing how my contribution and how that startup's contribution can improve the status quo.
Okay, good to know. So if we're sending anything your way, we'll make sure it helps the world make the world a better.
Please.
I have one last question, obviously, given that our focus is also on the global south, a term which I'm sure is debatable in itself, but developing world, emerging economies, high growth economies, the non-aligned, whichever way we want to call it. With your experience in Brazil and your experience in Bangladesh, the two Bs, East and West, what would you say are the advantages and the disadvantages of that you might find in Asia, if there are any, and similarly in Brazil, and where is the VC money flowing more towards, in which parts of the globe?
I mean, in both countries, you have a huge market. Combined almost half a billion people. It's both have a large emerging middle class. They've got acquisition power. They've got access to the internet. They're mobile first. They're young, so they're quick to adopt. So there's a lot of opportunity. There's also less competition, because there is so much to be done. It's not sort of, you're not working in a very tight wedge as you might be in Europe, and really defining that niche. You've got more to play with. However, talent is an issue. There's a scarcity of exceptional people because the really, really bright sometimes have left and not yet come back because they can send money home, and they have more opportunity in the US and Europe, at least perceived opportunity. So finding those superstars who want to staff your team with is getting trickier. At the same time, of course, there's been massive leaps made in education in both countries. So hopefully that gap at some point will close quicker. You are operating in governments that are not very transparent, so the rules can change from one day to the next. Everybody plays dirty, and Bangladesh in particular is a misunderstood market. So people understand Brazil, people understand India. Bangladesh has a higher per capita income than India, for example. It's the seventh most populous nation in the world, but it's hard to attract capital there for whatever reason, and so there's a lot of sort of PR needed in order to make it as attractive as India, Brazil, excuse me, Indonesia, perhaps.
So perceived risk is an issue, obviously.
Perceived risk is an issue. There's been a democratically elected president, but in power for the last 25 years. There's other issues like that, and if you're not with the government, you're against them by definition. So which can make your freedom to operate tricky at times, or at least I had a personal experience of that in Bangladesh. And then in Brazil, things have changed for the better very rapidly in the last 8 years. There wasn't really much of an ecosystem. There's a very strong ecosystem now. Exceptional talent. Nubank is the most valuable digital bank in the world that's come out of Brazil. There's several unicorns now in place where 8 years ago there weren't any, and Argentina was first with the production of a unicorn in Latin America. And now some of the biggest US funds have funds dedicated to looking at LATAM. SoftBank has a fund looking at LATAM and Brazil. So money is definitely flowing. When we were at Dr. Consulta, it was incredibly hard because investors didn't know what to make of the real and the fluctuation, and we're generally just quite nervous about writing the first check. So that's definitely changed for the better.
Good news. Well, Viva Brazil, they had a huge stand at the Web Summit yesterday.
I'm not surprised.
Yeah, by far the most colourful, by far the kind of loudest stand. So it was quite interesting to see as well how countries represented themselves at the Web Summit, and certainly Brazil was there full force. Well, thank you so much, Kat. Thanks for joining us at the conversation.
Thank you.
Very soon.
Thank you very much, Eleanor. Have a great day.
You too.